Hey guys, thank you so much for watching. I'm Adrienne, and if you watched my last video, it was me talking about me finally getting my date for jaw surgery to fix my underbite, and that's actually in 2 days. So what I'm going to talk about in this video is mainly like prepping for the surgery, what I've done, things I've bought, what I've researched to get ready for the surgery. So yeah, let's dive into it. So the very last thing my doctor said to me, he was like, I only have one piece of advice. He's like, do not get sick from now until the surgery. He's like, because if you do get sick, we will cancel the surgery. Makes sense. If you're going to be getting a cold, sore throat, whatever, where you're like coughing and there's going to be like movement in your jaw, makes sense that they're not going to want to proceed with the surgery because you need as much like stability and non-movement as possible before, like while you're recovering. Not getting sick. I had a call with the hospital like team a week ago, so 7 days exactly before the surgery, so last Tuesday, and she asked me questions like, was I allergic to any sort of medicine? And I'm allergic to amoxicillin and penicillin for antibiotics, so she noted that down. Asked if I had any history of like falling, nausea, am I hurt, like do I have open wounds, infections? Like she just went through the whole list of questions that she had to make sure that you're ready and healthy for surgery. And then the hospital also actually called to ask what type of hospital room you're looking for. I am getting my surgery done at UBC Hospital, and she asked me if I wanted to do a semi-private room, which was available for $165, a private room, which I think was $195, but basically $200, or if I wanted a 4-person room, and that would be free. Because in Canada, we pay for healthcare, so like our MSP would cover that. So I'll let you guys know what I end up with. So in terms of the things that I bought to prepare for this surgery, honestly, not much. I did a lot of research beforehand, and people have like lists and lists of things that you can buy. And when I actually like brought that list to my surgeon's office, I was like, hey, do you guys recommend me buying anything? Because if you do, I'm gonna start buying this stuff so that I'm not like rushing at the very last minute. And they actually told me not to buy like a ton of things. They're like, honestly, you don't really need that many things. So I have a Wedge pillow at home that I bought many years ago. I brought that to, I'm at my parents' house right now, but I brought that to my apartment, so I'm going to use that. I also bought condiment bottles because I've heard that you can use a syringe to take your liquids in, but it might be kind of annoying to just like syringe it so many times. So I bought those squeezy condiment bottles from one of like the wholesale, shops here. And so I'm going to be putting like water, my soups, juices, whatever in this bottle and just squeeze it in my mouth. And then the other thing, button-up shirts. I read online was good because you're going to have swelling on your face. So you don't really want stuff where you're putting like clothes or tight material like over your face. And so I was going to go out and buy button-up shirts, or go ask the people around you if they have button-up shirts that they don't want to wear anymore. Like when I said that, my fiance was like, no, he's like, don't go buy that. He's like, use my shirts. And so I was like, I guess. I'm like, why would I go buy button-up shirts just because if I don't need to, if I don't intend to wear them after? So I'm going to be wearing his old button-up shirts, the ones that, you go to Hawaii or tropical vacations, like that kind that you buy. Anything basically where you don't have to like lift it up over your head. I didn't buy any ice packs because my surgeon's office actually gave me 8 ice packs of the like little kind of square ones. They said that the hospital used to give those out, but budget cuts. They do not give you ice packs anymore. But what you will get from the hospital is like a face sling. And so she said, use the face sling from the hospital, but use our like ice packs that we're going to give you to like hold like ice around your jaw. The face sling or the head wrap thing, my surgeon's office actually said just to use the one from the hospital because some of the ones that they sell on Amazon, they said are too tight. And so people end up wearing the sling and it might be too tight here. So it does end up reducing your swelling by your jaw, but then like it just means it pushes the swelling onto either your nose or your lips. So you can't really avoid the swelling, I suppose. It just depends where the swelling is going to move to. So they said just use the hospital one. It's going to be looser, like it's going to feel loose, but that's on purpose because they don't want it to be too compressed against your skin. The other thing that I had done research on that I was curious about, and I asked them, they said don't do it, was to drink clear Ensure. So Ensure is something that I'm going to be drinking as part of my recovery like liquid diet plan. But there was a thing called Clear Ensure that people were saying, like, if you drink that as your clear liquid after that like 12 a.m. where you're not allowed to eat anymore, they said that there's like proteins or at least like some substance in there that like at least makes you feel less hungry. And so I had brought that up with like the people from the hospital, brought that up with my surgeon's office, and everyone just kind of said like, don't do it. They're like, just follow. But I think they're always going to say that, right? Like they always want to have things be as controllable for them as possible, which makes a lot of sense. Like if they're used to having people come in with just clear liquids, water, juice, apple, cranberry, if someone else throws something else in the mix that is unfamiliar and maybe that reacts like a little bit differently, it just makes their job more difficult to figure out what's wrong and to treat you. And so just water and juice for now. And the other thing I also looked up was after the surgery, again, I'm only doing lower jaw, so maybe this wouldn't be as bad anymore. But when I thought I was still doing the top jaw, people said that your nose would get really stuffy. And basically, if your nose is stuffy after the surgery, don't like blow your nose or do anything to like clear it out because there's like blood clots forming. And so like you want that to happen because you don't want the blood clots to come loose. I was like, okay, so no blowing the nose. Like the only thing you really get is a nasal rinse spray from the hospital, which is safe to use, of course. But I asked them like, can I use a humidifier in the bedroom? A lot of people online do use, and I suppose it like helps them, but the surgeon's office said, don't do it. You basically just like don't want to do anything that might cause the blood clots to dislodge. And I also asked about like Vicks, you know, like anything with menthol to help you like breathe a little bit better. And she also said no to that. She was like, anything that you usually use to feel better when you have a cold and stuff like that. She's like, this is not a cold. Like you're getting stuffy for a reason because the blood clots are forming. She's like, so don't do what you typically would if you were having a cold. So I didn't get any of those. Like I'm not planning to use them. Again, I'll tell you guys like what it's going to be like if I'm only getting lower and how stuffy I get. But yeah, like really the only things I've gotten is that Wedge pillow, some button-up shirts, and then the squeezy condiment bottles and ice packs from my doctor. So not really much to prep in terms of buying, but I've laid out like what kind of meals and stuff I want after the week. I'm going to be alternating basically between Ensure, I got the chocolate Ensure, coconut water for some electrolytes, diluted apple juice, it says. Full on like 100% apple juice might irritate your stomach because there's too much sugar. And actually I've already been freezing a couple of different soups. I bought super cubes on Amazon, which I will link it below to show you guys like what that looks like. But they're like these silicone molds for like freezing soups basically so that you can like pack it in your freezer. I think I'm probably going to even use it for meal planning after this, but I thought those were cool. And so I've made egg drop soup so far, and then also this like pork bone soup. Everything, by the way, I've like used an immersion blender to blend the heck out of all this stuff. So it's truly just like liquid by now. I've also blended lentil soup, but my lentil soup has come out pretty thick. The form is like a puree, and so I don't think I'm going to be able to have that in my first week, but I'm saving it for whenever I can start having pureed foods, maybe in my second or third week. We'll see. I've bought like frozen mango chunks because I like mango. I have some strawberries, but I don't think I'm going to have that right away because people were saying like, don't get anything with seeds that might potentially like get stuck in your incisions and stuff like that. So no strawberry for now, but I did freeze some fresh bananas so that I would have that in my smoothie also. And then I also bought protein powder to put in the smoothies because I read online that protein is really going to help speed up your recovery and help your body basically like repair. And you're going to be missing a lot of protein if you're just on a full liquid diet. Like if you're just drinking juice, coconut water, like you're not going to have a lot of protein from that. So I'm hoping that I'm going to get the protein from the Ensure, maybe some from some of the soups that I've blended, and then also from fruit smoothies that I'm drinking. I'm freezing them ahead of time just so it's easy for me to like heat up after. The doctor told me that you can't actually like drink the soups until they're at least room temperature or even just lukewarm. So no hot liquids in your mouth. And yeah, I'm afraid that I'm going to be hungry because I think I will be, but I think I feel pretty good about being prepared for the surgery. in terms of like a meal plan. Like anything else that I might need, Uber Eats. The only thing the doctor did say was that if you're doing like soup delivery or like pre-ordering soup ahead of time, just make sure that like you're ordering from places where you can see the ingredients, because one thing they've seen from other patients is that they get pre-made soups and some of it has so much like salt content in it that it ends up making them swell so much more. So that's the one thing that was the benefit of like making the soups myself, was that I was able to see how much salt I was putting in the soups versus just getting like, you know, prepackaged soup from the grocery store. I think I forgot to mention that I'm going to be spending one night in the hospital. So I've also got some things packed for the hospital, change of clothes, mainly like my iPad, a book, headphones, a charger. Nothing really. I mean, I feel like I'm probably going to be kind of out of it after the surgery, and just wanting things to like comfort you. So like maybe you want to bring like your favorite blanket or your favorite sweater, whatever. But yeah, I'm going to be spending one night in the hospital, hopefully getting discharged on Wednesday morning, and then coming back to rest and recover from home. In terms of medication and stuff like that, so I've gotten azithromycin, which I think is my antibiotic. I've gotten T3, a mouthwash, like an antiseptic rinse, T3 every 6 hours, and then this other painkiller every 6 hours. So I'm taking everything every 3 hours. And then I'm supposed to rinse and gargle with that antiseptic mouthwash twice a day, they said. The surgeon also gave me like a toothbrush. You really still need to brush your teeth while you're recovering. A lot of people are like scared to brush because obviously your mouth is going to be like terrifying. But they're like, it's really important that you just brush a little bit to prevent any infection or bacteria on like sticking to the infection site. So yeah, I think I'm going to brush my teeth, of course, but go super, super slow. So I'll show you again what my bite looks like right now. There's been no change since the last video I posted, but I thought I would just show you again in this, and then I will take a video of what it looks like after. So I'm biting down. Down. Up. I think I forgot to mention one thing in my last video, which was one side is getting cut 8 millimeters, whereas the other one is 7. If you look, which honestly I've never noticed my whole life, but you know, I guess all these surgeons are trained to see it, but he said this side is longer than the other, which is why they're cutting 8 off instead of 7 on this side. So, well, I guess we'll see if there's some more symmetry and, you know, to my face after the surgery. We shall see. But yeah, that's it, you guys. This is gonna be the last full video that I am going to share before the surgery. So I'm excited. I'm nervous. I am prepared. I mean, trying to not feel all the things because I don't want to freak out before the surgery. But wish me luck. I will take footage from the hospital before and after, and I will post all of this stuff after. So thank you guys so much for watching. Again, comment below, leave me your thoughts on the process so far. If you've already done surgery, you know, did you buy anything else? Like, you can share it with the other people that are also in the comments and doing their own research. So yeah, thank you for watching. See you guys next time.